Hello and welcome to Catamount Community Connection, our weekly Sunday program here on Catamount Radio. I'm Brian Collamore and the host of the show each week, and we call that Catamount Community Connection because we speak with community leaders from the business, professional, nonprofit, and political arenas on occasion. Our program is brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846. Again, on behalf of the board of directors there, thank you so much, I guess they're trustees actually, for attending this year's Vermont State Fair. And we're already looking forward to the 179th fair, believe it or not, coming up next August, 2025. So this week, we are very pleased to have as our guest the CEO of the Rutland Regional Medical Center, Judi Fox. And Judi, welcome in. This is, I think, your first appearance on the show, but hopefully not your last. How are you?
I'm well, thank you. Thank you for having me this morning.
It's great. And we traditionally, when we have someone that hasn't been on before, give them a chance to sort of tell their story, at least in a biographical manner, to the audience listening. Some people you may know a long time from the area. Some people may not know who you are. So why don't you tell us a little bit about how you are, where you grew up, how did you ever get to Rutland Regional Medical Center?
Sure. So I'm a Vermonter. I have grown up in Rutland County. I went through public school systems. I went through the Mill River school system. Went to college in Vermont, in Burlington, at Champlain College. And then had the wonderful opportunity to work in between semesters of college at the hospital. And had some great mentors, went back to school, came back to the community again, and I was offered a full-time job at the hospital. I can't tell you how many different positions I've had there, but it's been a wonderful career. I've had lots of mentorship, lots of coaching with people who were invested both in my leadership as well as in just the leadership of the hospital. I've been at the hospital 34 years. I kind of grew up on the finance side of things, was the controller. And previous to the CEO role was the CFO for the hospital. And so I have the privilege now of working with great teams across the organization and advocating for great health care for this community.
It may or may not be of interest to anybody. I don't think I've ever mentioned this on the air. I did work when I went to high school back in Concord, Massachusetts. Right on Route 2, there is a health institution called Emerson Hospital. I don't know if it's still open. I can't tell you one way or another, but I worked there in the summers because I came up to go to Middlebury College, and I would go home on summers. And I worked in housekeeping at Emerson Hospital for, I don't know, 4 or 5 summers anyway. And I finally graduated up to become an OR tech, which was really interesting and completely different than, well, quite honestly, emptying bedpans and that kind of stuff. I mean, but that's what I did for some summers. So that was my only sort of connection to a healthcare institution. But I think it's certainly a very crucial part of our community. We had a meeting last week with the Rutland County Legislative Delegation and those that are running for office this year, along with many of your teams in the building, Judi, and we talked a lot about cost, and that really is what we're probably going to concentrate on a lot today. I know you've come up with a strategic plan, but I did think it was important for people to realize that you are from the area, so you know the sort of fabric of the Rutland County community, and it's important, I think, that is true. And so I guess one of the things that we could start about is a strategic plan, and you sort of announced that to the group. I know there are different what are called pillars of information, and we will definitely get into the Green Mountain Care Board at some point as well. This is all sort of interrelated, but maybe you can just sort of outline what you've come up with for some long-term priorities and areas of focus for the Rutland Regional Medical Center in terms of a strategic plan.
Sure. Yes. So our strategic plan was about a year in the making, and this was the great work of our leadership at the hospital as well as our board of directors. And really concentrating on how we had to reimagine Rutland Regional Medical Center, particularly coming out of the COVID years. And what we saw were needs and priorities that had changed a bit for the hospital. And some of those needs were around staffing, and we had significant staffing challenges. At our most dire state, we were looking for 200 employees to join us. We also saw a need for increased access, not only for our community members, but community members across the state who were seeking services at the hospital. So those two pieces really drove a strategic plan. Along with knowing that, and I'll be the first to admit, healthcare is expensive. And we all have a part in how we play in that. So our strategy started with a mission and a vision reset, and that mission is to provide high quality hospital and specialty care for all through the strength and compassion of our people. And this was really intentional. It has a nod toward health equity, the for all piece, wanting everyone to know that we do appreciate that there are concerns with health equity, and we need to address them. We want to be a high-quality hospital, not just for Rutland County, but across the state. We think we have excellent physicians, advanced practice providers, nursing staff that can provide great care for our patients. We also have a very giving community who has helped us expand services, whether those are services in psychiatric care, imaging, most recently an infusion center. So we have a lot of infrastructure and a lot of equipment, and then talent and workforce to be able to expand our mission. And then our vision is to excel at meeting the needs of those we serve as the preferred healthcare provider and employer. And so we've been very focused on being a healthcare provider of choice. New to this statement, we want to be an employer of choice. And we'd like to create an employee experience where employees help recruit. And then when they join us, they stay. This is all kind of driving our strategic plan, where we have 5 different strategies around that being an employer of choice, access to care, quality, financial stewardship, which is where affordability comes, and then transformation, because we know we're not in a sustainable path. And Rutland wants to be at the table, both at the state and the federal level, to determine how best to transform healthcare, both in care delivery as well as payment transformation.
I should have probably teed it up by saying I think there are 14 hospitals in the state.
There are.
Okay. I served on the Health and Welfare Committee in the Senate my first term, and I have to be honest with you, I spent most of the time trying to memorize acronyms. It just seemed like there were so many different things and people would speak about, AM, QM, PM, and I'm thinking, I don't even know what that is yet. So I don't feel like I was ever that effective in the committee. And then the next year, or the next term, I switched over to agriculture. So I haven't been as focused, if you will, on the situation with our health care. But I know that there's 14. I know that the UVM is probably the largest in the state, and I'm guessing that Rutland Regional is the second biggest.
We are the second largest hospital in the state.
So I wonder also sometimes if COVID had never happened, what sort of trajectory were we on prior to that? So let's go back to maybe 2019. And think about that maybe for a little bit. I think the costs were still going up. This is all, there's an intersection with insurance companies as well, and they're struggling to stay in business for the most part, although a lot of people feel very negatively about them. I think at the moment we only have 2 in the state, Blue Cross Blue Shield and MVP. So there's not as much of a competitive sort of situation as you might want to have with insurance people. But all of that sort of comes into play here. And we did have COVID. I mean, there's no way to go back and undo it. But I think it really did change life in so many ways for so many people.
Yes, so I will say that COVID was definitely a life changer, but we were on a trajectory before that. Rutland County is an aging community, and we see our community members aging year after year. The older you get, the more healthcare services that you need. And then you move from a commercial payer to a state or federal payer, and quite frankly, they don't cover the cost of care. And so while COVID definitely accelerated and maybe exaggerated the issues, the underlying issues have been there. And so, the other piece that I think came out of COVID for sure, much like the education and the school systems went through a few years ago, hospitals are being asked to provide more services than just acute medical care. And there's a cost to that. And you'll hear me talk about the hospital being the safety net for the community. And what do I mean by that? Well, we have, at any given day, 8 to 10 patients that are residing as inpatients in our hospital that don't need acute medical care. But unfortunately, they have no place to go, no safe discharge plan. Maybe they're homeless. Maybe they don't have a caregiver to support them. So they stay with us more as what we call a custodial a patient. And that has a significant cost. And so that, we bring that into our cost structure. We also, I don't think it's a surprise to anyone, have a homelessness issue here in our community. And those individuals seek shelter, seek food, seek warmth at times, and have, a fairly significant presence requesting care in our emergency room. And so there's a cost there as well. In terms of where we're headed with some of our benefits. Again, looking at community infrastructure, we have a housing issue. True story, we, just a few weeks ago, in dire need of an imaging technologist, and had a nice conversation, offered them a job, they accepted, they came, couldn't find housing and had to decline. And so that is a real obstacle. I think that has been exaggerated by COVID. And then the other piece that we're looking at as an employer of choice is childcare. And how do we support our staff and have our staff have the opportunity to work, but also have a safe, enriching environment for their children to grow up in.
Yeah, you mentioned the older folks, and I'm one of them, okay? We are, as far as I know, the second oldest state in the country. I think Maine is still a little bit older in terms of, proportional things, but that does drive some of what is needed in terms of healthcare for sure. It's funny, all of these little elements seem so intertwined, and it is a function of government at some point to try to figure it all out. We did work on Act 250 last year and making some regulatory reforms which would allow more development, which translates into building more houses, quite frankly, or at least taking existing homes that maybe are not suitable for habitation right now and getting funding so that whoever owns that building can fix it so that it becomes rentable or purchasable. And so that's one piece of it. And then the healthcare, as you mentioned, people expect to be able to get certain things done at their local health institution. And a lot of specialization has occurred over the last, 10, 12, 15, 20 years that probably wasn't available before. I can remember when Rutland Regional got its first, or its only, MRI thing, and it was like a big celebration. Everybody in the community was talking about, well, we don't have to drive any great distance anymore to get that particular service. So there's always that to consider. And again, as you point out, Judi, and we're speaking, by the way, with Judi Fox from the Rutland Regional Medical Center, the CEO there, if you can't find people Well, you found somebody that wanted to work for you, but they couldn't find housing. So if you don't fix the housing problem, you automatically have put yourself in a challenging position to find people to work, because if they can't, I mean, there's only so many jobs you can do remotely, right? You could probably sell a lot of products without going out and actually doing face-to-face. But I don't think healthcare is one of them. You know, we did talk a little bit the other day about telemedicine. But in the end, if you're going to operate on someone, you can't do that by watching a screen. You actually have to have that person with you. So there's all these issues that sort of add to the challenge, I think, for a lot of our health institutions.
Yes, and so we agree that healthcare is a person-to-person delivery. There are areas, particularly in the administrative side, where we are looking at and actually employing a remote workforce. Our data and our analytics, our IT teams,
Sure.
our coding teams. And we've been quite successful. And that's important, because what COVID did for just across the nation in workforce, prior to COVID, our competition was, in Vermont and Northeast. And with COVID and the ability to work remotely, our competition became national. Because you can live in Vermont and work for a company in LA. And so we've had to really pivot, and we've had to be innovative at ways in which we can recruit and kind of go out on that limb with some of those opportunities for remote workforce. In terms of telemedicine, it's an acute healthcare setting. It's mostly not appropriate. There are areas where it is appropriate. Behavioral health is a great example of that. We do employ telehealth. We have a behavioral health clinic within our we call system of specialties, our specialty medical clinics, and they've been very successful with telehealth. So there is an opportunity, I would say, for our community. Telehealth is more relevant with our primary care network. Okay.
The other thing you mentioned, and this obviously was something I think that COVID made even worse, is our homeless situation. So in one sense, your ED, emergency department, becomes sort of the last resort for so many people, it seems. It's also very expensive to do that. And so we haven't yet figured out a way to, and I don't think we'll ever necessarily fix totally the homeless situation, not just in Rutland County, but throughout the state and quite frankly, the world probably. There's always going to be someone that needs help from someone else, whether they're a single mom, they have a disabled situation, or they're just older and they need some help. So you mentioned there's on an average maybe 8 of those folks. And then the added complication, because some of that is substance use issues, and then there's that mental health aspect of it. So it's resulted in, unfortunately, some really terrible situations that come up when people get violent in the ED with your staff. And we did do a little bit of work to pass something which I hope helped out. We certainly heard originally that it was going to be a good idea. So that's sort of a situation that is set apart, but it is integral, I would imagine, in the day-to-day operation of the. And we talked about the recent shooting last week in Rutland and how that caused folks to have to go into lockdown. As we record this show on Tuesday, the 24th, and it'll air this coming Sunday, that person, whoever was responsible for that shooting, still hasn't been apprehended, to my knowledge. At least as we record this, it hasn't been. So that was maybe part of why you had to do that, because the person responsible was still at large, and so that must have added to the whole situation the other day. But I did want to mention that because that was something that you probably previously hadn't had to deal with on that large a scale, where you have people just coming in that they don't have any place else to go.
Correct. Yes, so we've been very committed to a posture of safety. Our work will never be done there. We're constantly reevaluating and responding to changes in our environment. But we've done a few things. We've had some commitments. Some were a little difficult for us, quite frankly. Easier things to do. We've increased our security staff by about 40%. We have security at main entrances so that we can have eyes on visitors and individuals who are entering our facilities. What was hard for us is putting a metal detector in our ED. We want our facility, it's a community asset. We want people to feel invited and welcoming. We want it to be a caring environment. But we had to balance that against the safety of our staff. And unfortunately, we were encountered with situations where weapons were coming into the hospital. And we felt we didn't have any other choice. And so we've had that metal detector in place, I think 6-8 months now. Went in as a pilot, and we have committed to that long term. And what we've found is our community members are grateful for our posture and safety, and our staff certainly is. The shooting incident, it's really important that we make some quick decisions. We work out of an abundance of caution, and if we think there's any likelihood of harm, we do have protocols. We have a great security team that works on these types of issues, and so we can go in and out of these situations fairly quickly. We post extra security as needed, and we have, a great working relationship with our policing agencies here in town, and often resort and lean on them for some support.
I guess it's just a fact of life. When you reach a certain age, you always sort of look back on the way things were, 30 years, 40 years ago for me. And much like what has happened in our schools, where when I went to school, the doors were open, they were unlocked. You didn't have to worry about people coming in and creating a bad situation. That has completely changed. Now you have to sort of stand in front of this thing so people can see who you are before they allow you to open the door and come in. And I understand that, and I fully support that. And I'm sure the same thing is true in our hospital situation, where, way back when you could just walk in and it was not a big deal. Mm-hmm. So we're constantly, I guess, responding to new ways of doing things, and unfortunately, a lot of times it's again, for those of us that are of a certain age, it's not as pleasant as it used to be, but it's a fact of life, and that's the way things go. So we're talking to Judi Fox, the CEO of the Rutland Regional Medical Center. We started to talk about the strategic plan and the pillars, and Judi has mentioned those. We do need to take our first break, and when we come back, maybe we'll detail a little bit more of workforce needs at the hospital. I'm guessing there are some positions that might be a bit more difficult to fill. I know if somebody asked me to become a nurse, I would have absolutely no idea how to do that. So that's one, and the traveling nurses is obviously another situation we can talk about at length. And then I do want to get eventually to the report that came out. Well, there's two reports. There was a consultant report that hinted about specialized situations for each of the hospitals. And we've begun to talk about that at the school level, too. And also the, I think, rather unfortunate decision by the Green Mountain Care Board to cut back on revenues for our hospitals. So let's take our first break here on Catamount Community Connection, and we'll be right back with Judi Fox. We're back on Catamount Community Connection. I am Brian Collamore, your weekly host for the 1 hour show. And again, this week, very pleased to have with us the CEO of the Rutland Regional Medical Center, Judi Fox. And we've been talking a little bit about some of the challenges that have occurred as a result, of COVID in the last 4 or 5 years, but just that sort of gradual change in the way that we live and the way people think about things. And I think that was important to get through. I do want to talk about the workforce needs. You can't have a hospital without people working there, and people that love to work there. And I always hear good things about the Rutland Regional Medical Center, both as a place for customers, but also a place for employees. So what are some of the positions that are harder to fill? Maybe we can find somebody if they are listening to the show somewhere, because this will go out over 5 stations, and maybe somebody's listening in another state and says, wow, maybe I could move to Vermont and work at RRMC. I'm assuming traveling nurses have to be a large part of this. And again, that was something that COVID sort of created, I think. Maybe we had them before. I don't know. Did we have traveling nurses 5 years ago, 6 years ago?
We did, but not to the level that was required, in the middle of COVID and then post-COVID. So
what are the kinds of jobs that you're looking to fill, and how many are there of them, and how do people do that? Sure.
So, So first off, we employ from the age of 17 to I think our oldest employee is mid-70s, and so and we're we have trades, we have nursing positions, we have finance positions, we have administrative positions. So we have a lot to offer the community. As we sit today, we need about 125 more individuals to fill all of the positions that we feel are required to take care of our community. About 25 to 30% of our workforce is nursing staff, and of those nurses, we're supplementing with travelers or temporary staff. And we've got about 60, 65. They're not all nurses. We have some what I call high-end imaging, MRI, CT techs, respiratory therapists, those types of positions. But certainly, without the support of these individuals filling these roles temporarily, we'd have to shut down access. So we are very dedicated and intentional to this pillar of employer of choice. We've got about 4 different objectives that we're looking at. The first is around benefit offerings, really looking to reward and benefit those employees at all aspects of their age and their family and individual needs. We're looking at housing and how do we dip our toe in housing, primarily to support that workforce we're trying to recruit, and childcare is another. We're looking at talent management. We know that we've had a significant turnover in leadership at our hospital, and we choose, individuals who excel. Maybe, they're, a great accountant or a great nurse, and then we put them into a leadership role. We've not really been as intentional and dedicated to supporting them in this advanced role. So we have a talent management strategy that we're looking to kind of move forward. We also have Grow Your Own programs where we're taking LNAs and supporting them through their RN program here at local colleges. We're taking 2-year RNs and supporting them to be a bachelor, a 4-year degree RN. We're looking at minimum wage, and so we will be raising minimum wage for our organization again, which is really important. While I say that we have significant openings within our nursing, if you look across our cohort, the trades, plumbers, and electricians, and we're in demand of those. We have internships in those programs to try to, again, grow our own. Housekeeping, our dietary, same thing, and that's where minimum wage, we're hoping, will invite those individuals to have interest in coming to work for the hospital. And then we have outreach to our colleges and higher ed, and we actually have nursing staff who provide instructorship and teach classes for colleges, and really trying to extend that offer to come to work to Rutland early in their college career.
I know when we talk with Police Chief Brian Collamore and even the state police, we talk a little bit about, and maybe it's a negative thing to mention, poaching. So, you have to sort of be in competition with other hospitals for employees, and I don't know whether that sort of happens in the healthcare field or not. It does in law enforcement, and they were pretty open about that. If someone is willing to pay you a lot more money for doing pretty much the same thing you're doing now, and it may be from out of state, sometimes law enforcement people move and take a job somewhere else. Is that on the radar at all with you folks?
It is, and it happens, and it happens in cycles, not just with other, Vermont hospitals, but with our community agencies as well, whether that's primary care, Rutland area visiting nurses, Rutland mental health. We don't target any of those individuals, organizations, or other hospitals. We do advertise, obviously, but it's never, a direct let's go after this individual. But Vermont is a small state. Rutland County is a small county, and employees are looking for the best deal.
Yeah.
It is not to our benefit for us to, move employees from the mental health agencies or the home health agencies or primary care. We rely on their services. We kind of demand their services at times. And so when they have staffing shortages, we feel it at the hospital. And so really try to be very collaborative around recruitment and how we support each other. That said, we do have employees that travel back and forth.
Yeah, well, I guess that's natural, and it's a free country, as they say, right? So you should be able to do what you want. Okay, so that takes a little bit of the 125 positions that we're looking to fill at the Rutland Regional Medical Center. The other thing I wanted to mention, and let's assume that a patient is sort of a customer. So let's talk a little bit about customer satisfaction and the ways in which you measure what has been the experience of a particular customer, or in this case, a patient who may have come into the ED for a particular reason. There's a certain amount of time that it takes to take care of them, or maybe it's a pre-planned surgical procedure that they have, signed up for and then gone through. And how do you sort of find out how well you did?
Yeah, so that's a great question, and that is actually a focus within our strategy pillar of quality of care. And so if you've received services at the hospital, more than likely you have received a survey. And we are trying to modernize our survey approach and move from paper to kind of an electronic survey. But we have patient experience specialists who receive anonymously these aggregated survey results. And we read every comment, and we look at root causes of concern. And this is all in an effort. We really want to be a learning organization. And so we want our patients, our visitors, our staff to identify areas of improvement. And these patient surveys are a great tool for us. We've developed dashboards for every department that are based on these patient surveys. And I'll tell you, this is new work, and I really want to promote our quality department. Led by Kelly Watson, our Chief Nursing Officer, who felt that this was an area of improvement for the hospital, and she's kind of met it head on. And we've really highlighted and amplified the voice of the patient, and we've had some great findings and opportunities to improve care. Not everyone, walks away feeling like, we could take care of their concern, but certainly we try. We also have a quality committee. We also have a quality committee of our board that is very engaged and works on behalf of our community to engage with our clinical leadership across the organization. And we have hundreds of metrics we look at around infection rates and falls and access to care and how long it takes to receive care. And so there are various groups that our medical staff as well as our hospital leadership and clinical teams look at this data and again try to find themes and areas of opportunity.
And I think it is important that there is that attitude that it's not a static situation like, well, we did this and we're going to do the same thing again with this patient, the same thing again over and over and over, because there's always ways to improve. There's ways to become more efficient maybe. Or I've never had a bad experience, I got to say. I've been in there a little bit for a blood draw or something, and I don't know how these people get up in the morning and they're so cheerful about sticking a needle in somebody else's arm and drawing blood, but they're always that way. They're always sort of friendly, and it's really, it's been a good experience for me. And occasionally you'll see letters to the editor that praise what happens at the hospital. I don't remember ever reading something where somebody was crabbing about it. I think it's all been pretty positive. So that's really good to hear. And I think it is important to understand that you can always sort of do a better job if you are willing to listen to what people tell you. So.
And that's part of, as we consider recruiting new employees, we're really looking for fit. And skill is really important, but so is fit. And we want our employees to be very mission driven. We're here to take care of our community and our patients. And that we need to show up with that mentality and treat every patient. And we actually have a motto, every patient is my patient. And it doesn't matter who you are in the organization, that there are opportunities for you to extend support to family and patients as they encounter, services at the hospital.
I guess there's a distinction between those folks who didn't choose to go to RRMC for their care. In other words, if you're in a vehicle accident somewhere, they don't sort of stop things and say, well, where would you like to go? They put you in an ambulance and take you. And then there's the other side of it where people do choose where they want to have a particular procedure done. And I don't know what the percentage is, but you probably have a pretty good idea how many people come in without sort of picking it, sort of.
Sure, yeah. So I'm proud of the hospital overall. We have a very busy emergency room, and you never know what's going to show up. And we save people's lives every day. We have a very committed clinical staff, physicians, advanced practice providers, our nursing staff. And I think we treat about 34,000 patients a year. Very busy. And that spans from, mental health, illness, substance, trauma, and then, stepping down in medical issues. So really, really important work there. We call our front door, or the emergency room, our front door. Mm-hmm. But also, and where, this might segue into, concerns that I have for healthcare in Vermont, what we have seen, and I'm very proud of our organization for this, from 22 to 23, and this has continued, we saw our first really increase in treating patients outside of our community, which is where we started with our mission and really expanding that aspiration of who we wanted to be as in terms of providing health care in the state. And our demand for services outside of Rutland County increased by almost 25% in 1 year. And they're coming to us seeking advanced imaging, orthopedics, general surgery, cardiology, oncology, and cancer care. So very broad-based, and they're coming because we provide great service, great care, quality, timeliness, and something that our community should be really proud of, to know that others are seeking to use our services.
Yeah, for sure. We have probably about 15 minutes left, and we need to take one more break. I do want to get down to the Green Mountain Care Board's decision. We talked a little bit about that during the legislative meeting the other day. But I think it is important for people to understand that, everything that we do costs money. There's no way around that, and it's the last bill that normally gets passed every session is the appropriations bill, and that's where all of the senators and representatives vote to spend a certain amount of money, and then it's appropriated in the two appropriations committees to figure out who's going to get how much of the pie. So we do need to talk about costs. There's no way around that. And we did have a recent decision from the Green Mountain Care Board that is, I think, very, very challenging for not just Rutland Regional Medical, but for all of our 14 hospitals statewide. So we will probably tackle that issue when we come back with Judi Fox in just a moment. Welcome back to Catamount Community Connection, your weekly Sunday public affairs show. I'm Brian Collamore, and with me today is Judi Fox, the CEO of the Rutland Regional Medical Center. And again, in our remaining, 15 minutes or so, I did want to focus, because we've talked a lot about the strategic plan, the workforce needs of the hospital, and how they sort of get a report card, if you will, of their patients and their customers. But a recent decision by the Green Mountain Care Board has indicated that Rutland Regional Medical Center should reduce its net revenue by $6.3 million beginning on October 1st. And I just want to give Judi a chance to give the folks who are listening a glimpse of what sort of implications that has for our needs here, especially in Rutland. But I'm assuming that they didn't just pick Rutland. I think there's probably a similar, I'll use the word angst or concern statewide about the recent decision. So I'll leave it to you to sort of pick the football up and run with it.
Sure, thank you. I'm really passionate about this issue and this concern, and this directly ties to very strategic and intentional goals around access to care that our leadership team has very deliberately chosen in response to services that we know it takes too long for patients to receive care. So the ruling and the decision with the Green Mountain Care Board, a piece of that was related to our performance in 2023. And essentially what they said was that you created too much revenue, you treated too many patients, so we're going to take some of that money back. And so in their defense, they allowed us what they felt was to cover cost, but they still are going to take back about $5.5 million. And the way they do that is they reduce our rates to commercial payers. So it's a hit. It will impede our ability to move forward with some of these access to care initiatives. In addition to that, in our budget, which begins October 1st, based on, again, very deliberate initiatives to allow our patients to access care quicker and to respond to the fact that patients from outside of our community are coming to Rutland Regional for care. We had about a 6.1% increase if you go year to year in our revenue. And they basically said that was too much and have mandated, and there are penalties for not meeting this mandate, that we need to cut back our revenue. The only way to cut back revenue is to cut services. And this is really problematic for our community, and it is in great contrast to our intentions with our plan, and quite frankly, with the Oliver Wyman Act 167 report that said essentially that Rutland Regional Medical Center should grow. And we should have some aspirational initiatives that look to create greater services in our community so that we have to transfer fewer patients to tertiary care centers. Tertiary care centers are hospitals like Dartmouth, UVM, Albany Medical Center. And so with this requirement to peel back, if you will, over $6 million of revenue, here are things we won't be doing. We know that if you need an MRI, it can take over 2 months to get that scheduled. While we have just invested in an upgraded MRI, we were going to bring a second MRI on and be able to provide 1,200 additional MRIs in a very short period of time. We're not going to be able to do that. We've just ended a 2-year renovation. We have 5 surgical rooms in our OR suite, and we really modernized those rooms with a nod to just improving safety and efficiency. And our plan was to open all 5 rooms. Historically, we've only operated 4. We will not be able to operate all 5 rooms to the extent that we wanted to. And then we're going to have to look at specialty care in some of our clinics. We just opened a new infusion center that I'm very grateful for our community. They donated over $300,000 for that program. It allowed us to double the size of our chairs. So infusion therapy, as a patient, you come in, you could sit with us for 6 hours while blood is being medications are being infused, and there's a great need for that. We might have to pull a few of those chairs offline. What's really disappointing is we have the staff, we have the facilities, we have the equipment. We just don't have the approval, if you will, to offer these services. Rutland Regional Medical Center is not alone in this. I think of the 14 hospitals, 12 of them have had some similar reduction, with UVM being the most dramatic. And UVM, I don't know their final numbers, but it's north of $50 million. That impacts Rutland Regional Medical Center too. We rely on UVM for transfers. UVM sends specialized physicians and providers down to our community. They run an outpatient dialysis center in the footprint of the hospital, and we're very concerned about those services.
Yeah, that I know there were some other eye care visits, and you mentioned the dialysis, which that's critical for people who are without the ability to go to RRMC for that service. They're going to have to drive quite a distance, which just adds more of a challenge for them. And I'm just wondering, again, how we might be able to get all of what you want to do in terms of being able to grow and still, I guess, satisfy the Green Mountain Care Board. It looks like we're at a little bit of a disjunction there, and I don't know how to fix it. I really don't.
Yeah, so we don't, the leadership team and our board at the hospital, this isn't meant that we want to bury our head in the sand and think that there isn't anything that we can do. In fact, over, I think it was the last 3 years, we've cut over $10 million in expenses. And that has a direct impact to commercial rates. There are things to do, and we need to lean in. But we need to lean in as a collective group across the state with community agencies, state government, all working in partnership. We have this, strategy around right care, right time, right setting. That doesn't happen. And when we have patients, residing with us for months at a time with no medical need, they're not in the right care, the right place, and it's expensive. We don't have a functional statewide ambulance system. So to get patients from our care setting to a UVM or Dartmouth, it can take days. There are times when we send our own nursing staff in the back of an ambulance to try to get patients to where they need, the most appropriate care. And so Rutland's ask, if you will, is let's talk about the barriers. Let's talk about the cost of care challenges and try to problem solve those. Simply cutting revenue does not eliminate the need for people's health care. In fact, it's likely going to cost more. So with the reduction in revenue, there are a number of individuals who have the wherewithal, who have the financial stability, that they'll go elsewhere. Mm-hmm. They'll go out of the state for care. That doesn't save Vermont money. My concern is with the most vulnerable, those individuals who maybe aren't sure how to navigate a very complicated healthcare system, those individuals who don't have transportation, don't have money to stay, overnight in a hotel. They're going to go without care, and they'll show up when their care is so acute and so emergent, and it will cost more than had we taken care of these patients along the way. And so we are really trying to open up dialogue with anyone who will listen, including the Green Mountain Care Board, the Agency of Human Services, our state legislative group, and try to come to some type of understanding as to how we can address the cost of health care, but not on the backs of our community members not receiving care.
Is there any sort of appeal process with the Green Mountain Care Board? Is there a way to say, hey, can we talk about this again, kind of?
There is, and we are very engaged in that appeal process. We don't yet, so through the budget deliberation process, it's a fairly legal process at this point, and we'll receive a formal budget order that will tell us, everything we need to do to comply. We have to get that budget order first to really understand all of the detail, but we are prepared to advocate for our community. And what does that mean? It may mean a legal process. We certainly want to be part of any conversations statewide that will, help to magnify this issue and understand the impacts of care and the risk of not getting care.
I know the Vermont Medical Society is having a meeting, I think it's this coming week, October 1st, with the legislative folks as well. So I'm sure that will be brought up that night, at least I hope so. And, it seems like if there's a cohesive group that's beginning to talk back and forth about this, that maybe we can come up with some plans and some new ways to look at things to solve the problem. Because in the end, as you mentioned, the need doesn't just disappear because someone said, well, you can spend X amount less than you did this year. The need is going to be there, and especially, as you correctly point out, Judi, it's for a specific population that doesn't have the wherewithal to go somewhere else because they have resources to do that.
And that is my concern, as we commit to this work around health equity and trying to ensure that all individuals receive the health care that they need. This decision by the Green Mountain Care Board is really going to challenge us in health equity because it is going to disadvantage the most vulnerable in our community.
So we've got about 3 minutes left. I didn't know if you had any sort of closing, and we didn't. I mean, we could talk about this for days, probably, all the ins and outs of healthcare. It's as complicated as figuring out how we fund our educational system, to be frank. I think there's about 4 people in the whole state that can actually explain that, and we've talked about that in other shows. But, we could have opened up a lot of other topics with you today, but I'll just give you a couple minutes if you want to sort of wrap up things, let people know what they can do if somebody's listening and they have a concern, what they should do about it, all that kind of stuff.
Sure. So I'd like to end with kind of on a positive note.
That'd be good.
Really, we're very proud of our hospital and the service we provide and the support we provide to our community. We're also very grateful for the support the community provides us. They show up with any need that we have. We have a very dedicated board. We have a 19-member board, and those board members are in the 4 walls of the hospital weekly and are very dedicated and devoted. And so we have the opportunity to really make our hospital a success story, more than it is today, and a real gem, not just for Rutland, but for the state. I consider the Green Mountain Care Board's latest decisions kind of a bump in the road, something that we need to face. We need to lean in. But the long-term success of the hospital, I am very encouraged. We have some stability in our leadership team. We've made some improvements. Most dire 200 employees down to 125. We've had a very successful recruitment of physicians and advanced practice providers, and we're not at risk financially at this point. We've been very prudent and very diligent, and that goes back years in the making from very sound leadership at the hospital. So I'd like to leave the community with that high note that you should be proud of your hospital. Always invite the voice of our employees, voice of our community, of our patients in. Please feel free. You can reach out to the hospital, and we have a link on our webpage where you can email, and our marketing and communications team will make sure that email gets to the appropriate individual to respond to. So.
And again, we had members of most of the teams in the meeting the other day, and also a board member, Mark Foley Jr., who I have great respect for. And he gave us a little bit of a not a tongue lashing, but at least a wagging finger, the legislature, that is. And I thought that was very appropriate. And, there are things that we can do when assuming things go well in the election and all, when we get back up there that maybe can make this a little bit less challenging, and maybe kind of like put some oil and make it feel a lot better kind of thing. I hope so anyway. So, Judi, thank you so much for joining us today. Judi Fox, the CEO of the Rutland Regional Medical Center, and it's been a pleasure, and we'd love to have you come back sometime.
I would love to. Thank you for the opportunity this morning. I appreciate it.
We will see you all next Sunday on Catamount Community Connection.